Hi, this is Dr. Kelly, and we're back again to complete the module on supplementation. This time we're going to talk about supplements I found to be useful for specific conditions like inflammation. Linus Pauling was a gentleman who has proven without a doubt the effectiveness of vitamin C as an antioxidant. In the past, the way we've taken vitamin C is challenging because to get enough, it actually causes diarrhea. The reason for that is hydrophilic, and it's attracted to water. But there's a new technology where they actually put lecithin around the vitamin C, which is a form of fat, and therefore it's absorbed in the stomach and not in the gut. So you get a high absorption rate and a very strong influence. We'll talk about that particular company in a moment, but it really has been proven to be helpful for my patients, and one gentleman in particular was able to cancel a back surgery. His pain was so notably improved. Another common anti-inflammatory is turmeric, you no doubt have heard of. It comes from a plant, and it's the seasoning that gives curry its yellow color. And you will see that when you take a capsule. It's very dark goldenrod. There's been some interesting data to prove that its anti-inflammatory effects are so powerful that it can rival Prozac for depression. So curcumin is the active constituent, and that would be likely what you would be buying in the health food store. Most recently, I've been exposed to something called Protandim for inflammation. I've been quite excited about the results of this. It's a new disruptive technology to reduce inflammation. They've identified a protein known as NRF2 that binds itself to the DNA sequence. So when this gene pathway is activated, it produces a really dramatic increase in antioxidant protection and decrease in inflammation. So I'm very excited so far, and we'll continue to use this with patients and see how well they do. With regard to people with muscle spasms, certainly magnesium is touted to be one of the best muscle relaxants without the side effects that typical muscle relaxants have. And we will always start with a form of magnesium if somebody has a spasm from pain. But after the fact, if somebody is cramping or they're achy or they always feel stiff or fatigued or even puffy, an electrolyte is pretty spectacular for these conditions. And electrolytes are just mineral salts. And there's a company in Spokane called Light Balance, and it's very inexpensive, very useful, and they've identified the ratios of sodium, potassium, and magnesium, just the right amount. So when you take it, you feel quite a lot easier inside of your body. So we recommend this for lots of patients because typically electrolytes come with a lot of sugar, and that's something we want to avoid. You might just take the back of the skin on the back of your hand and pull it up and create a little tent and then let it go. If that tent drops quickly, you probably aren't dehydrated. But if it kind of sticks around, either you're not getting enough water or the electrolytes are not pulling the water around in your body very efficiently. This would be a very nice way to complement that. And the last condition I want to talk about is nerve pain and fatigue as well, heavy-duty fatigue. Vitamin B is tremendous for nerve recovery. Anytime one of my patients has true nerve pain or pressure on a nerve from a herniation or even a nerve pressure through a particular muscle, B is very useful. The nice thing about B also is that it does increase your energy. Many of you have heard about B12 injections. The reason they inject that is because they want to get that into the system as quickly as possible and bypass the colon. So this is the company that creates the lipospheric vitamin C and vitamin B. We sell it in the clinic, but you can also get it on Amazon for the same price. I'm really a fan of this. You'll see there's a gel that comes out. You put it in a little bit of water or juice and take it quickly. It's highly absorbed and quite useful. So in summary, on a daily basis, I believe that you really do need omega-3s to counteract all the omega-6s. We talked about that in the fat module. I think you need vitamin D, particularly in the northern latitudes, and the last module underscored the need for probiotics and prebiotics. If you have inflammation, consider vitamin C, turmeric, and Protandim. If you have a muscle spasm acutely, try some magnesium, and then consider electrolytes, because our minerals are so depleted today from poor soil that electrolytes, which are again minerals, are often needed in many of us, even if we don't even know it. And the last thing would be if you have any type of nerve pain, try to get a B complex. So listen, you have done it. You rock. You have spent the time and the effort learning this critical information. If you want any further information on coaching or information on supplements, there's my email address. Please feel free to contact me there. And Booker, my youngest boy, will be very happy to hear from you as well. So I can't thank you enough for your interest and for your time. And I just want to let you know that I'm here for you.